Good morning and welcome. We're very pleased to host this interview with the team at HealthFinders Clinic in Minnesota, discussing their experience using DoxyMe telehealth platform in practice as part of their SMBP work. We are supported in this activity with funding from the Centers for Disease Control and Prevention 1817 grant as part of partnership with the Minnesota Department of Health. My name is Deb Delabrew. I'm a project facilitator with the Minnesota Department of Health, helping to support their learning collaborative activities as part of my work with Nourish Health Consulting.
Great, and I'm Reed Haase with Stratus Health. I'm a senior healthcare IT consultant functioning as a grant facilitator, working with both Jenny and Charlie at HealthFinders Clinic and a few other of their staff over time. And we're just going to do a couple of introductions here. Jenny, if you'd like to introduce yourself, and Charlie as well. And then Charlie, if you'd like to say a little bit about the clinic, the population that you serve, geographically, where you're located, and anything else that you think might be helpful. Great.
Yep. So my name is Jenny Teletor, and I am a CHW at HealthFinders.
My name is Charlie Mandilli. I'm the Executive Director, HealthFinders Collaborative. We're a community health center, not FQHC, but in many ways, spiritual cousins. But we serve an underserved population in Rice County, about an hour south of the Twin Cities Metro. Rice County is home to about twice the state average of Latino immigrants, as well as one of the largest outstate Somali refugee populations. Which comprise about 3/4 of our patient population from those two groups. Otherwise, we serve uninsured, underinsured patients across clinical programs, medical, dental, mental, and chemical health, as well as a range of wellness and community-based programming.
Great. Well, we started well over a year ago working together to stand up an SMBP program. And we have the benefit at your clinic of having this unique technology, DoxyMe, which is one of many possibilities of telehealth out there in the marketplace. Could you tell us just a little bit about how you started off with that technology, and then in the spirit of sort of start where you are, use what you have, do what you can, how you pull together your staff and this technology and your learning around SMBP to stand up that program, and generally just how it's working for you bringing these various pieces together?
Yeah, of course. Well, we started down this virtual journey because of COVID. Like most folks, we needed to pivot quickly. In addition to all the COVID needs we had, we've got hundreds of diabetics and chronic disease patients that we needed to figure out a way to care for at a distance. And so the easy part was finding Doxy and getting some licenses and playing with the virtual technology. But kind of the hard part was everything else. As with most things tech, we had a lot of providers that, technology natives are really adept at using these things, and they were able to integrate them into their practice quite seamlessly. For example, our mental health provider, she basically went home with a Doxy license and didn't miss a beat with all of her patients, and that was really quite good. But others, it was a bit trickier to both. Just the technical connections, but also integrated into our kind of team-based, clinic community-based workflow.
Great. Yeah, Jenny, could you share just a little bit about your experience with the SMBP program and collecting those numbers, and a little bit about what your patient interaction or experience is, how people reacted to integrating DoxyMe with getting those numbers? And we know it wasn't just that alone, but there's many other things that you discuss using that tool, if you will.
Yeah, of course. They were very shy at first wanting to use DoxyMe. Most patients were either at work or at home to where they just weren't comfortable being on camera. The way I found it best using it was right at the beginning. When I first had a referral, I had a case, and then I would go into showing them how to actually use the SMBP. It was nice to have that visual, being able to show them where the cuff goes and how you need to be sitting down with your arm up. I found that that helped them a lot. And then I would do the teach back. I would have them teach me again how it was used. The other nice thing about it was I'm a visual person. So I always like to carry images with me, right? So just showing them different images on, okay, what it is to eat healthier, how we can better your nutrition, exercise, what are some ways we can potentially do at home. And again, just a lot with the images.
So your experience was, so you taught them, they got the monitor at the clinic, they come and pick it up, and you actually taught them,
Yes,
yeah, DoxyMe, how to best use the device, and have them, like you said, do the teach back and demonstrate that they know how to use the device.
correct.
Can you say a little bit about any particular, maybe patient profiles, for lack of a better term, that took well to using DoxyMe with you? Or would you say it was across the board, all ages and, English speakers, non-English speakers, or you can say a little bit about those who you work with?
Yeah, so I've mostly worked with Latinx patients. They, at first, they are very open to it. Again, still a little bit shy with being on camera, or what they would say on camera. But it wasn't as difficult to really get them the first couple times. Afterwards, it was more so I don't have time, or can we just do it over the phone? However, I did have patients, they loved it. They were able to do it from their car. They had their other monitors with them. I'd give them a quick call. They were either on a construction site or in their place of work, and they run out to their car and quickly start taking their blood pressure, and they would give me their numbers right there and then. Same thing with having their numbers. They would write them down, put them inside their little bag, and that little bag was just super nice to have it be portable to where they could check at any time, any place. Even if they were shopping at the store, they'd take that minute to like, okay, just hold on, let me go to my car. And they would be able to show me from there.
Yeah. So also, how did it start out? Did you start with just maybe one or two, kind of pilot or trial patients and see how it worked? But you had the technology beforehand, so I'm assuming you might have felt a little bit more comfortable with the technology. So it wasn't you were just starting with SMBP and trying to learn that program and the technology at the same time.
Yeah. It was right when I started, it was like, as Charlie said, every provider used it. They kind of set it up for us CHWs to be able to comfortably use it with the actual patient. So that wasn't too hard. It was more so having them keep going once a week, once every 2 weeks, of again just them having time to actually be on the call. Some were more easier to get a hold of than others, but I really enjoy using it, especially through Doxy. It's easy to have a phone call, but it's nice to have a face that they can actually see, that they can actually be open to.
Right, yeah. And Charlie, what's the general trend using DoxyMe? So around the SMBP program, but are all of the CHWs, or maybe you can say how many folks on staff are actually using the technology?
Yeah, everybody's using it. I will say, it's taken us a while to get there. At first, it was a little bit. Some folks were slower to adapt than others on the clinic side. But we kind of regrouped and did kind of a larger process improvement project to understand what worked well for patients, for providers, for other staff. And since then, we've really our metric was measuring, okay, how many of the virtual visits were Doxy versus simple telephone, which we were also doing a fair amount of. And so, we grew from 0, obviously, to about 5 or 10%, and now almost half of our virtual visits are able to take advantage of Doxy, which we very much considered a success.
Yeah.
Going in, we knew that there were folks that we're going to love this and do it and really embrace it. And then there were going to be folks who just, it wasn't a great tool for various reasons and everything in between. And we needed to do it all. And so not really forcing it where it just didn't work, but also having it as a tool in our arsenal was I think the right approach.
Yeah. So definitely not a one size fits all. You just kind of figure out who that works for. best and use it with them, and those that like to use telephone. I understand in our conversations you've had during the pandemic here, people coming into the clinic still to some extent, when and where needed. Can you say a little bit about that? And then we're in this interesting phase here where we're all getting vaccinated and things will change, and maybe you see that DoxyMe usage go up, go down, or what's your, if you had a prediction where that might go?
Yeah, I think there's that kind of middle group that we could maybe convince them into it if we made it easier. And um, I think from the beginning we took the approach of pandemic or not, this is going to be a tool in our arsenal that we can maybe use. And as Jenny said, maybe it's really helpful at certain parts of the care pathway that and then interspersed with either in person or other check-ins in between. And so I think that really we really try to develop that that way, and I think we built the workflow to kind of help both the healthcare providers and the patients maybe take that first step and see the benefits. So things like having kind of more support staff in the back of the office. Even if our providers were in our clinic, they often needed somebody at the elbow to help make that connection. But also from the patient experience, number one, can we do some mass marketing and communications to get people kind of ready to accept the concept of virtual visits? But also, can we make the experience as kind of one click as possible? And so we really kind of imitated the physical waiting room with the virtual waiting room, so they could just kind of sit there and wait, and the provider would let them in and out. And Doxy has some great tools about that. So both in the in-person part of the virtual workflow, but also the kind of added distance at a population level, but also at an individual level. We worked hard to refine things so we could kind of get that middle group of people that could maybe be convinced to use it, to actually adopt it, both on our staff as well as patients.
Yeah, interesting that you shared that it reflects almost a in-clinic encounter in some ways, that there's a waiting room and so forth. And every technology is going to be a little bit different. There's some imitation going around, whether it's DoxyMe or some other solutions to have that more familiar experience, but some of them are more basic, rudimentary, almost like a FaceTime where you're just right there immediately and
Yeah.
so forth. But Jenny, if I could ask you, as our time winds down a little bit together here, what has been maybe just a little story, really good success story that you've had with this, and maybe just one challenge that you might want to share with people listening in on this?
Yes, of course. So I think one of my success stories were with one of my patients. She was very against being, virtually on camera. She just wasn't about it. However, after convincing her just more so to have the visual, like the images to actually show her the cuff, she started to come around. She started to get very comfortable. I realized when we were on the phone, she didn't really want to tell me exactly what was going on. It's so different from actually being able to see her face, her facial expressions. So after trying to convince her, I finally got her to start taking more calls virtually. And that is when it made such a big difference. She started opening up to me more. She started saying that, yes, I'm a real person. I'm here for you. I'm here to give you that support. Slowly, we started working on her BP, different ways of bettering those numbers. She actually cut back smoking. She was smoking 5 cigarettes a day. She cut back to 2, and slowly is doing just 1 a day. I mean, that was huge for her. I would show her images on what an actual plate would look like if we were to eat correctly. And again, just being able to see that she understood what needed to be done. And I get every single call that we've had, she has thanked me for those numbers that have been going down. Same thing with her medications, being able for her to show me some of those medications are long words for them and they can't pronounce them. So being able to put them up to the camera, showing me what those names are in order for me to reconcile anything or making sure that she was taking them properly. One challenge that I did find with most patients is just again, and I think I've said this, just them being very, very shy. They just didn't want to have their face on camera. They were too tired. They just got off of work. They've been running errands all day. So that was definitely a challenge. But after, at least it worked with some, after a little bit of convincing and then being able to see me face to face and seeing that I was there to help, they slowly started coming around. Some of them still aren't 100% on board, but I like to sneak in a little virtual visit now and then, just to see if maybe I can, change their mind still. But as of right now, I do have more like a 70-30% that like to do virtually. But yeah, I think it's amazing that we are able to even use this kind of platform. Unfortunately, with COVID, we can't really see our patients face to face. But at least being able to do it virtually, they can still see that they have that support from our clinic.
Yeah, I appreciate that, Jenny. And one of the nuances I think I heard in this story and the others that you're sharing with us is really the context of where you're reaching them. It's almost like when you call somebody on the phone or whatever, did I catch you at a good time? You mentioned a construction site environment at home, et cetera, and you never know what's going on behind the scenes and so forth. So it sounds like you really need to appreciate their context. And maybe that's part of the shyness that you were describing is there's other people maybe in the family or listening into the conversation and not necessarily in a private room where you are an exam room and you can have that security and privacy in the clinic and so forth. Any observations you'd like to share, Charlie, additionally, or?
No, I think it's really interesting. Jenny's clearly integrated this into her workflow, and in some ways, just listening to her talk now, a lot of the magic of the CHWs was in the home visit. Just something about going to somebody's house or being a part of their context really helped both the CHW understand a little bit more about the patient, but also the patient, sent the message that, here's somebody that's willing to kind of come to your house and your territory to understand what your life is like. Hearing her talk about how maybe this was at the workplace or in the car, maybe there's an interesting advantage there too, that, the CHW obviously in before times wouldn't necessarily go to the work site, but, having a low call at the work site might be an informative thing as much as a therapeutic thing for the patient. So I think it's as I said, I think it has potential to be an interesting tool long term, even when we do go back to more in-person modalities.
Great. Well, I appreciate all those insights, Jenny and Charlie, and appreciate the work we've been able to do over time and working with you on SMB people. I'll turn it over to Deborah, and she might have a question or two, or you can wrap us up as you're ready.
Yeah, I really appreciate hearing all of those insights and perspectives, your real world clinical experience. I think it's just so valuable to hear about. So thank you so much, Jenny and Charlie, for all the great work you've been doing. And Reed, thank you so much for helping to facilitate the conversation today and the work that's been moving forward with HealthFinders. I did want to thank all of you who've tuned into the interview today. If you do have any questions about any of the information you heard, you can reach out to HealthFinders. You'll see Charlie's email address at the bottom of the screen here, as well as the number for the clinic. And you can also find HealthFinders on the web at https //healthfindersmn.org. And if you do have any further questions or need any additional information, you can always reach out to the MDH Office of Statewide Health Improvement Initiatives at the telephone number and web address at the bottom of the screen. Thank you so much for joining us today.